Hi, in this video, we are going to discuss about humerus. Humerus is the bone of the arm. It has an upper end, a shaft, and a lower end. Let's discuss about the upper end first. The upper end has a head, a greater tuberosity, a lesser tuberosity, an intertubercular sulcus, and a neck. Let's discuss about the head first. The head is smooth and rounded in shape. It is covered with articular hyaline cartilage. It is directed medially, backwards and upwards, and it articulates with the glenoid cavity of the scapula to form the shoulder joint. The glenoid cavity of the scapula is very shallow when compared to the head of the humerus, which allows for wide range of movements. Next, let's discuss about the greater tuberosity. The greater tuberosity forms the lateral part of the upper end. It projects beyond the acromion process and is covered by the deltoid muscle. The greater tuberosity receives the insertion of three muscles. The upper part receives the insertion of supraspinatus. The middle part receives the insertion of infraspinatus. And the lower part, it receives the insertion of teres minor muscle. This muscle is the supraspinatus muscle originating from the supraspinous fossa of the scapula and inserted onto the upper part of the greater tuberosity. This muscle is the infraspinatus muscle originating from the infraspinous fossa of the scapula and inserted onto the middle part of the greater tuberosity. And this muscle is the teres minor muscle arising from the lower one-third of the lateral border of scapula and inserted onto the lower part of the greater tuberosity. Next, let's discuss about the lesser tuberosity. This is the lesser tuberosity, which receives the insertion of the subscapularis muscle. This muscle is the subscapularis muscle originating from the subscapular fossa of the scapula and inserted onto the lesser tuberosity. The supraspinatus, infraspinatus, teres minor, and subscapularis, all of them together are called the rotator cuff muscles. In between the greater tuberosity and lesser tuberosity is the intertubercular sulcus. The transverse humeral ligament is attached to both the tubercles here and it prevents the dislodgement of the long head of biceps. The intertubercular sulcus has a medial lip and a lateral lip. The lateral lip receives the insertion of the pectoralis major muscle. This muscle is the pectoralis major muscle, originating from the sternum and the clavicle and then inserted onto the lateral lip of the bicipital groove. The medial lip of the bicipital groove receives the insertion of the teres major muscle. This muscle is the teres major muscle originating from the lower one-third of the lateral border of scapula and inserted onto the medial lip of the bicipital groove. The floor of the intertubercular sulcus, it receives the insertion of the latissimus dorsi muscle. This muscle is the latissimus dorsi muscle coming from the back and then inserted onto the floor of the bicipital groove. This constricted portion behind the head is called the anatomical neck of the humerus. The junction between the upper end and the shaft is called the surgical neck of humerus. Next, let's discuss about the shaft. In the upper part, the shaft is circular in cross-section, whereas in the lower part, it is triangular in shape. It has three borders and three surfaces. Let's discuss about the borders first. The anterior border extends from the lower part of the greater tuberosity and extends till the junction of capitulum and trochlea in the lower part. The upper one-third of the anterior border forms the lateral lip of the bicipital groove, which receives the insertion of pectoralis major muscle as discussed before. Next, let's discuss about the medial border. The medial border extends from the lower part of the medial lip of bicipital groove till the medial condyle in the lower end. In the upper part, it receives the insertion of the teres major muscle. Next, let's discuss about the lateral border. The lateral border extends from the lateral epicondyle upwards. At the level of the deltoid tuberosity, the lateral border fades. And finally, it ends on the posterior part of the greater tuberosity. Next, let's discuss about the three surfaces: the anteromedial surface, the anterolateral surface, and the posterior surface. The anteromedial surface is between the anterior border and the medial border of the shaft. In the middle of the shaft, it receives the insertion of the coracobrachialis muscle. This muscle is the coracobrachialis muscle originating from the coracoid process of the scapula and inserted onto the anteromedial surface of the shaft of the humerus. Next, let's discuss about the anterolateral surface. The anterolateral surface is between the anterior and the lateral portion. In the upper part of the anterolateral surface is the V-shaped deltoid tuberosity, which receives the insertion of the deltoid muscle. Below the deltoid tuberosity, The anterolateral surface along with the anteromedial surface gives the origin of brachialis muscle. This muscle is the brachialis muscle originating from the anterior part of the shaft of the humerus and inserted onto the ulna. The rest of the anterolateral surface gives origin to the brachioradialis and extensor carpi radialis longus muscles. This muscle is the brachioradialis muscle originating from the anterolateral surface of the humerus and inserted onto the radius. And this muscle is the extensor carpi radialis longus muscle, which originates below the brachioradialis muscle from the anterolateral surface of the humerus, runs along the radial side of the forearm and inserted onto the base of the second metacarpal bone. Next, let's discuss about the posterior surface. The posterior surface is between the medial and the lateral border. In the middle one-third of this surface is the spiral groove, which runs downwards and laterally. The radial nerve and the profunda brachial artery run in this groove. Above the spiral groove is the oblique origin of the lateral head of triceps muscle. Below the spiral groove, the rest of the posterior surface gives origin to the medial head of triceps muscle. Above the lateral head, the axillary nerve and the posterior circumflex humeral artery run across the posterior surface. Next, let's discuss about the lower end. The lower end has articular and non-articular parts. Let's discuss about the articular parts first. The capitulum and the trochlea are the articular parts. Let's discuss about the capitulum first. The capitulum is a spear-shaped structure. The anterior and the inferior parts of the capitulum are articular, whereas the posterior part is non-articular. The capitulum articulates with the head of the radius. In flexion, the front of the capitulum articulates with the head of the radius, whereas in extension, the inferior surface articulates with the head of the radius. Next, let's discuss about the trochlea. The trochlea is an asymmetrical pulley. It articulates with the trochlear notch of ulna. It has an anterior surface, an inferior surface, and a posterior surface, all of which are articular, and they articulate with the trochlear notch of ulna. When the elbow is flexed, the anterior surface of the trochlea articulates with the trochlear notch of ulna, whereas in extension, the posterior and inferior surface articulate with the trochlear notch of ulna. Next, let's discuss about the non-articular parts. The non-articular parts in the lower end are the radial fossa, the coronoid fossa, the olecranon fossa, the medial epicondyle, and the lateral epicondyle. The radial fossa is the part which is above the capitulum. The radial fossa accommodates the margin of the head of the radius in full flexion. The coronoid fossa is the fossa above the trochlea, and it is occupied by the anterior margin of the coronoid process in flexion of elbow. Next, let's discuss about the olecranon fossa. The olecranon fossa lodges the apex of the olecranon process of ulna in extension of elbow. The medial epicondyle forms a blunt palpable projection which is directed medially and slightly backwards. The tip of the medial epicondyle gives attachment to the ulnar collateral ligament. The antero-inferior surface of the medial epicondyle gives the origin of the superficial group of flexors of forearm. The posterior surface of the medial epicondyle has a groove for the ulnar nerve. Here, the ulnar nerve can be rolled against the bone, producing a characteristic tingling sensation. Next, let's discuss about the lateral epicondyle. Lateral epicondyle is a less prominent projection than medial epicondyle, and it is directed laterally and slightly forward. The tip of the lateral epicondyle gives attachment to the radial collateral ligament. On the anterolateral surface, it provides the common origin to the superficial group of extensor muscles of the forearm. Posterior surface of the lateral epicondyle gives origin to the anconeus muscle. Next, let's discuss about the ossification of humerus. The humerus is ossified from one primary center for the shaft, 3 secondary centers for the upper end, and 4 secondary centers for the lower end. The primary center for the shaft appears at the age of 8 weeks of intrauterine life. The secondary center for the head appears at the age of 1 year. For the greater tuberosity, it appears at the age of 3 years, and for the lesser tuberosity at the age of 5 years. By the 6th year, all the secondary centers for the upper end, they fuse to form a compound epiphysis. This fuses with the shaft at the age of 20 years. Coming to the lower end, the lateral flange of the trochlea and the capitulum is formed at the age of 2 years. The medial epicondyle is formed at the age of 5 years. The medial flange of the trochlea appears at the age of 10 years. The center for the lateral epicondyle appears at the age of 12 years. The medial epicondyle fuses with the shaft by a separate epiphyseal line at the age of 16 years. The remaining 3 centers, they form a compound epiphysis and fuse with the shaft at the age of 18 years. Since the lower end of the epiphysis fuses earlier than the upper end of the humerus forms the growing end. Thanks for watching this video. Please consider liking, sharing and subscribing.